Dr. Benet, we've been long awaiting the COVID-19 vaccine, and there's a lot of excitement that it's here now. I thought it might be helpful for us to get together and have a conversation about how important the COVID-19 vaccine is for us in reducing the risk of transmission. Given how quickly it was developed, is it safe?
Yes, I want to reassure everybody that we do have a safe vaccine here. There has been a lot of work done by the pharmaceutical companies, regulatory agencies, really devoting a lot of resources, extra resources compared to normal, which have allowed us to go quickly, but they have followed all the normal processes to assure safety. And so we do have a safe vaccine that we're working with today.
How effective is it?
Thankfully, the studies really do show that the vaccine is quite effective. The Pfizer vaccine, which is the first one that we're receiving, is showing to be about 95% effective in preventing the COVID-19 virus. The following vaccine from Moderna is showing that it's about equally effective as well.
Can someone get COVID-19 illness from getting the vaccine?
Vaccines that have attenuated viruses or virus parts do not cause infection, and these vaccines that we are receiving are of the type that do not cause COVID-19 illness.
And what could be the side effects?
We are seeing some side effects with the vaccine, most of which are things like body aches, headache is common, and even some fever, low-grade fever. So it is important, especially for healthcare workers, to make sure they schedule their vaccination so that the next day they're not planning on working, should they have these side effects.
So I know we've received some questions about if you've already had COVID-19 illness, should I still get the vaccine?
Because we don't know how long immunity from having had COVID-19 lasts, the recommendation is that you do get vaccinated. And so we will be moving forward recommending to all our colleagues that they receive a vaccination whether they had previous illness or not.
Who will get the vaccine first and why?
There's been really good work done by public health agencies, national agencies, and right here in North Texas by regional bodies like the health systems working together so that we prioritize the rollout of the vaccines, starting with those that are most closely supporting the care of COVID-19 patients in the region.
We know that no vaccine is 100% effective. So what else can we do to help curb the virus?
It's a very good point. While the vaccine rollout and getting a vaccine is a big positive step in how we win against this pandemic, we will continue to want to maintain our practices of masking, hand washing, and safe distancing so that we get all the benefits of that protection plus the vaccine as we push back on the pandemic successfully.
Is the vaccine going to be required for all of our colleagues?
Getting the vaccine is not mandatory. However, we do recommend getting it for your protection and of course your part in protecting the entire community. It is important to note also that while we're starting with this prioritized schedule, we will have enough vaccine over the coming months to make sure that everybody in the healthcare worker population and community who wants to get one can get one.
By getting vaccinated and doing all of these measures that you've mentioned, it'll just help us get back to being with our family and friends faster and get back to a more normal and healthier tomorrow.
That is the goal.